Hi everyone and welcome to Katie's Take. I have a feeling this is going to be a very popular episode because we all have bad habits, but the good news is we don't have to break some of them. J. Ryan Fuller is a clinical psychologist, and Ryan, I guess this should be called When Bad Habits Happen to Good People. And you're saying that there are sometimes actually bad habits that aren't bad for you. For example, I am a master procrastinator, but that's not necessarily a bad thing.
Not necessarily. It depends on the outcome. So for lots of people, as they're approaching a task, they become really anxious. And so if they use procrastination in the short term to bring that level of arousal down, they might be able to re-engage and get things done.
Do you think some people just work better under pressure and stress than other people, and it actually procrastinating might be motivating for them?
It turns out some research has been done on this, and researchers broke procrastinators up into two different kinds. One's an active procrastinator who report just that they actually believe they work better under pressure, and so they do delay and postpone just as much as passive procrastinators, but their outcomes are better and they're not as anxious.
Okay, I think I'm the positive procrastinator. Let's talk about coffee. A lot of people are in the habit of drinking several cups of coffee a day. Is that bad for them?
Well, the first thing is, and coffee is a little tricky. Anyone making a change to their diet with regard to coffee certainly wants to talk to their physician. A lot of research, though, some large epidemiological studies show that coffee consumption can actually prevent type 2 diabetes. But again, you want to make sure that you're talking to your physician, because if it's caffeinated, there might be issues around blood pressure and things like that.
What about chocolate, Ryan? I'm a chocoholic, but I understand that dark chocolate is supposed to be good for you because it's an antioxidant. So is that a habit I don't necessarily need to break?
Yeah, most physicians that I've spoken with don't typically have people who eat chocolate cut it out completely. Doesn't mean they're going to have someone who doesn't eat chocolate start. But dark chocolate has antioxidants in it, specifically the flavonoids, and those have been shown to lower blood pressure and improve blood vessel function. And so in some large studies, the higher consumption of darker chocolates actually does seem to reduce risks for heart disease.
Well, love me some flavonoids. And let's talk about napping, because some people nap and they may think it's not a great idea because it'll affect their sleeping later on when they actually go to bed for the night, but that's not necessarily the case.
Not always. The studies on this are mixed, and so some studies actually indicate that napping can disturb people's sleep at night, but there have been other studies that show if people are napping occasionally and it doesn't disrupt their nighttime sleep, there might be health benefits. They might be sharper mentally. There's even some evidence that it might improve reaction time and immune function.
What about having that afternoon cocktail or a glass of wine? A lot of people are in the habit of doing that. When do you know that's okay versus you're doing it too often or you're drinking too much?
Yeah, anytime a patient's coming to me and they're asking questions about alcohol or something with a medical risk, we want to make sure that their physician really does a thorough assessment. So oftentimes physicians will recommend 2 glasses for a male and 1 glass for a female. There does seem to be some evidence that antioxidants in red wine, for instance, can be helpful, and there's even some evidence that alcohol in general, across the board, regardless of the type, might help thin the blood and reduce clotting. But again, given the risk for alcoholism and things, you want to make sure that the physician clears you for that.
And finally, how can you tell when you go from having a bad habit that isn't so bad for you to having a serious problem with habitual behavior?
Sure. So in terms of looking at the behavior, there are usually 2 things to pay attention to. The first are the outcomes. So it could be a particular medical outcome, or it could be a behavioral one. In the case of procrastination, am I missing my deadlines? Am I causing interpersonal conflicts with my coworkers? And then the second piece is the function. We want to make sure that if I'm choosing to eat dark chocolate or to have a cocktail, that it's really about enjoying that, about the pleasure and what I'm approaching, and not about sort of avoiding and putting off feeling anxiety or worries.
All right. Well, J. Ryan Fuller, clinical psychologist, thank you very much for talking with us today. And thank you all for watching Katie's Take. You can see all the episodes on Yahoo or at abcnews.com, and check out katiecouric.com if you'd like more information about my daytime talk show. Until next time, I'll see you later.
Mr.